Okay, so listen up. You go to bed on time, but then you end up scrolling on your phone for hours and not actually falling asleep. Does this sound familiar to you? A 2016 study found nearly 3 out of 4 adults delay their sleep at least once a week for no apparent reason. Sleep expert Amanda Jewson is going to tell us why we're doing it, how to stop doing it. Good morning to you.
Good morning.
And there's a name for this, sleep procrastination. So explain what that is.
It's exactly what it sounds like. So it is the delaying of wanting to fall asleep or delaying putting yourself to bed. We do this, it's also known as revenge bedtime procrastination.
Wait,
because
what?
people are taking revenge against the lack of leisure time in their day.
Yeah.
So they delay going to bed and they do fun things like you're saying scroll TikTok, watch television, stay out late with friends, but they're not making up for that sleep, so people are left in sleep deprivation.
And who is most vulnerable to this revenge sleep procrastination?
Well, the studies around this are actually pretty new. So the concept of this is relatively new. However, a 2019 study out of Poland suggests that both women and students are the prime candidates for sleep procrastination. There's also a suspicion that the COVID-19 pandemic has pushed people into this because we brought our jobs home with us. So our lack of leisure time is really impacting us. And so essentially anyone who's feeling the push-pull between work and leisure time is at risk.
That's so me, because I have to go to bed earlier than probably most adults.
Yes.
And I have to wake up so early. It's really the only time I have to look at something that is fun for me, right? You know, like there's not a lot of time during the day. So what are the health risks associated with this?
So we see quite a bit. So first we want to talk about those emotional health risks. So a study out of the Journal of Clinical Psychology talked about people who are participating in sleep procrastination are more anxious, they're more depressed, and they're more irritable, which makes sense. We're not sleeping, we're not at our best selves. But we also have a physical component. Folks who are participating in sleep procrastination have a higher risk of obesity, cardiovascular disease, and, you know, in this day and age, catching just about any virus that is thrown at us.
Honestly. Okay, so how can people stop pushing back their bedtime?
So, you know, sleep procrastination is actually a big deal with my clientele. I work with new moms primarily. And so I always say the first thing that we have to do is admit that there's a problem. If you are getting less than 7 hours of sleep,
I just put my hand up every night.
Every night. But if you're tired and you know that you're doing it, it's time to make a change. Then we need to consider what we can do during our day to create balance. So even scheduling, you know, for someone like yourself, you go through your calendar, you're gonna block out 15 to 30 minutes of leisure activity. Block out your scroll time during the day. Block out that walk. You know, the more you do it during the day, you're going to need to do it less at night. Make your bedtime routine so enjoyable. Make that the thing that you're procrastinating towards. Then you want to do the not so fun things. You want to take out all of those electronics from your room. You want to make sure that there's nothing that's keeping you awake. You want to go to bed at the same time every night. You want to wake up at the same time every morning. That'll make your body kind of cue you that, hey, it's time to go to bed. It's time, you know, to wake up. It'll make going to bed so much easier. And then finally, there was a 2022 study that said that sleep education is a protective factor against sleep procrastination. So obviously keep watching your morning.
Oh my gosh, especially when you're on. Quick question about, so let's say you want to set your bedtime for 9 o'clock, okay? Bedtime. So let's say you get into bed at 9 o'clock. How much time should you give yourself just to like hang out before you should really shut it down?
Great question. So they say an hour before you're taking away any sort of stimulus. So screens, telephone, anything stressful in your life. You don't want to go to bed too early. So if you want to be in bed at 9, you don't want to be doing super duper boring things like, you know, laying in bed or meditating because your sleep pressure isn't building at the same rate. So give yourself a good half hour of maybe a nice skin routine, reading a book, you know, something calming that isn't screen related. Does that make sense?
Well, I'm just wondering because when I go to bed, like I have to read before I go to bed. So I'm in the bed and then I'll read. And then sometimes that's when the procrastination kicks in because it could be 5 minutes or 30 minutes. But I'm wondering if there's an optimal night, like once my head is, like once my body's in the bed, should I just have like a 10-minute window where the lights go down?
Yeah, you could do that, like a little wind down routine. I'm wondering, is your phone in your room with you?
Both phones? They are. They are. They're right beside me.
I like that you have two.
Yes.
Yeah, if you remove that, if it's possible for your job, removing it removes the temptation. I can't tell you, I don't sleep with my phone, and my job is very phone heavy. I'm constantly on the line with clients. Moving it out of your room is a game changer, I promise.
All right, we'll end on that note. Amanda, thank you. Always good to see you. Great tips as always.
Thank you.